So my name is Nevada Norris, like Catherine said, and I'm a new PA here at FADC. I'm offering cosmetic treatments as well as medical, but today we're going to focus on the cosmetics. So for undergraduate, I went to the University of South Florida, a little bit about me, go Bulls, and then for PA school, I went to the University of South Carolina, so I'm clearly very Southern. These are our logos. I'm more of a Bulls fan though, let's be real. So what do we offer here at FADC? So one of the main things that I do on a daily basis is a chemical peel. One of our most popular is the Perfect Peel. That's a deep to medium peel. We could talk about it here. So it helps the glutathione in it, which is a very unique ingredient in the Perfect Peel. It helps with melanin metabolism and hyperpigmentation. So those are like the dark spots, melasma, those things that a lot of women and men both want. It also helps with acne scars, which is very good. So I have a lot of patients that come in that are looking to improve their acne scars or the hyperpigmentation that they have from having acne or previous cystic acne. The kojic acid is a lightening agent, so it helps with the things like melasma, like we talked about, and the TCA, phenol, and retinoic acid are the most common ingredients that are in chemical peels regularly. They can help correct pigment problems as well, and the salicylic acid is good to exfoliate the skin and retexturize. So these are some great pictures. You can see here that this patient had active acne as well as hyperpigmentation and some scarring from previous acne that she had. And then over here, this is just after one peel. She has significant improvement as far as the hyperpigmentation as well as the appearance of acne scars. And then this is another patient. You can see that she has some pretty significant freckling here along the nose, and this is just after one Perfect Peel treatment. A little thing about the peel is that you have to have about a week of downtime. You can't exercise or do any, excessive heat onto the face. I've even had a patient tell me that they couldn't cook dinner for their children because the boiling heat was too hot for them. So just make your husbands or wives cook for that week. But it's an excellent peel. It's one of my most popular things that I offer here. So the other peel that I have is the Vitalize peel. So this is a little bit of a lighter peel. It just kind of makes you peel like you have like a light sunburn, or sometimes people don't even peel at all. It's a chemical exfoliant. So it can help with the appearance of fine lines and wrinkles and the unevenness, some minor unevenness in the skin tone. So one of the main things I offer here is dermal fillers. So my favorite that I like to do is Restylane Kiss and Juvederm. So what is a dermal filler? So hyaluronic acid is found naturally in your body, but when we put it into the skin, it attracts water and allows for volume and to fill in fine lines. It can also restore volume and fullness, which we lose with time. So as we age, we get less subcutaneous fat, and so we like to fill in those areas so that we can restore fullness to the face, restore youthfulness to the face, and also as the skin ages, it stretches a little bit, so we like to restore the volume there as well. So, and then other things, that could affect the skin texture is the sun, environmental exposure, and just hereditary and lifestyle choices. So one of the main things that we offer here is Restylane Kiss. This is probably my favorite product. This is mostly for the lips and for fine lines around the mouth. So this is for someone that's looking for support or volume, that wants a flexible formula. So something important about fillers that in the past was not something that was considered as much was the flexibility. So now with these new products, there's more flexibility. And that's important for products that go around the mouth. So as in the nasolabial folds, the marionette lines, the lips, and the fine lines around, we call the barcodes around the lips. Because you're smiling and you're talking and you want it to move naturally. You don't want it to be stiff. And then this could last up to a year.
This is one of the items that we will be raffling out at the end of the event.
Oh, yes. So we can raffle one. So that'd be great. So you can see here that it really doesn't, a little goes a long way. So this is only 3/4 of a syringe right here. So you can see here, she actually has a very nice shape, but she just wants some hydration. You can see she has some fine lines here. And then just an overall slight volume. here you can see this is one full syringe, but you can see she has, you know, they're pretty thin and she has some barcoding going on. That's what I like to call it with the fine lines. And here she just has a little bit more of a fuller lip. And with here, this is actually a little bit over one syringe, but you could see she has multiple fine lines and that she wanted a lot of volume in the bottom. So it's really tailored to you, and whenever I do, whenever I inject a patient, I really tailor it to themselves. So over here is a couple patients that I've done. So this one, she just wanted very subtle volume, just something like a little bit of a pout, but nothing too crazy, more of hydration than anything. And then this is actually myself. So I had very, you know, thin lips, and I feel like I have a nice shape, but I just wanted a little bit more volume in order to enhance them. And this is my friend. You can also use them for chin enhancement. So you can see here she has, you know, a little bit of a shorter chin. We always look for a chin that, you know, matches up with the lips. And so I projected it here a little bit so you could see it's more even, and that gives her a little bit more of a youthful glow and a little bit better of a profile. So this is about our cheeks. So we have Restylane Contour products and Juvederm Voluma products. So the most important thing about cheek filler is that we lose the loss of volume, like I said. When we lose the fat in the cheeks, that's what kind of gives us that older age when you get we call it the jowls here, the fat moves from here to down here. So we want to restore the fat up here so that, because the face can look deflated and it just ages you a little bit. So we're adding a little bit of volume here. You not only lift right here, but you can also lift the nasolabial folds by adding volume here and pulling the skin. And then some side effects of filler is usually just some mild sweating. We give you, or swelling, sorry. We give you an ice pack, tenderness, bruising, pain, redness at the injection site, but those are all super minor, and usually we don't really have any problems with that. So the difference between Botox and Dysport, that's the main question I think I get every single day. So Botox is a small spread, so it means it's a little bit more targeted with each injection point.